Today's topic is already in circulation among all the members and viewers. That is asthma. Asthma effectively curable with urinopathy. The mainly only on one subject, that is a disease asthma, a breathing related problem. Asthma is a chronic disease. There are a number of diseases, thousands of diseases are there, but they have been classified broadly under various categories. Common disease, chronic disease, acute disease, and degenerative disease, and opportunity disease, deadly disease, and that various group. And one group is called chronic diseases. Chronic means a disease that persists, that will exist for a long period of time. It means that patient has to suffer with that disease for a long period. That is called persistent. This is a type of disease that is relating to lungs. Means it is called bronchial asthma. This makes an easy body as a diseased body. Body will be always easy. When it is affected, it is diseased. So asthma will make the easy body as a diseased body. This asthma is not a communicable disease. It won't spread to others. A person who is affected, he alone has to suffer. It will not spread and fast move and attack to other people like infection, bacterial and virus infection. It won't affect. It is a non-communicable disease. Another important disease, this is a disease that will affect all the people, irrespective of male, female, and children. No discrimination. Even many children are also affected with this asthma disease. It is a very dangerous and a discomfortable disease to the human beings. Then we have to study this subject with reference to the urine therapy means you must understand the seriousness of the subject, the magnitude of the disease. What is the extent it is serious nowadays? That's called magnitude or seriousness of the disease. You see, it affects nearly 10 lakhs people every year. 10 lakhs people are suffering, newly cases registered, suffering with this asthma disease. And the United States of America, it is nearly 25 lakhs per year. This includes children also. You may also wonder to know during COVID-19 period, 262 million people suffered with this cough and cold influenza, and it is relating to asthma disease. Nearly 455 people died during the COVID period, Corona period. That is seriousness of this asthma disease, means the magnitude of it, the seriousness of how the people are suffering. People are suffering, living like a living death. It's not appearing outside, but those who are suffering now, it's a very serious problem. And another third important point is the location of the disease. Why this asthma disease is located in the body? The location, a particular place of this disease is air tubes, or you can say tubules are airway, breathing way. It is called tubes, airway tubes or air passageways. That is the location where the air exactly passes inside and goes outside. Inspiration, expiration. That is the location. Or simply air tubes or airways, it is called. That is place of suffering physically by the patient. The patient can know easily where that disease is there in the body. Because cough is there only in the lungs. That where the disease is located. This is a breathing problem, respiratory problem. inhalation and exhalation problem. Very difficult problem. It is like a suffocation. The patient will suffer like anything. It is a case of living like a living death for the patient because you cannot talk clearly and suffering internally. The organs of the respiratory tract that carries the air during ventilation. During ventilation time, the organs of the respiratory system organs that exactly carry the air during the time of ventilation, going out, coming out of the body. So the organs, the special organs and the tissues of the respiratory system will carry the air carry function or airways function, organ and tissues. These two are the important parts in the respiratory system that will carry function of airways, airway function, air passage function. I mean respiration then coming out of through the tubular air tubes. And the nature of this is I am explaining to you. When these tubes, airways or air passage tubes are blocked or closed, it is the case of asthma. What are the symptoms when we can feel that it is asthma? Means that the airways, the air tubes block or closes or tightens, narrow down. That is the case of or symptom of asthma. Because in the airways or air tubes are blocked now, the air will not freely move, it will narrow down. At that time, the patient will feel difficulty of breathing. Difficulty of breathing means air won't go inside and will not come out of the body. Inhalation and exhalation, respiratory system. So why these air tubes, airways blocks, means there are three important reasons why that airway blocks and the patient feels difficulty of breathing. One is narrow down of airways, narrow down, close down slowly. And swelling, in inflammation of airways or air tubes. And third method also is there, that is production of mucus, a jelly-like hard material, mucus. So when the production of the mucus is more higher than requirement or higher than normal, it is the case of asthma that will block the airways. The mucus will be coming out of the mouth often. These are all three conditions under which a patient, a person feels the symptoms of asthma. Under normal circumstances, we see a person who is not attacked or triggered by any asthma or respiratory problem. The muscle system of the airways or air tubes are smooth, easy, and quiet, and air easily flow inside and easily will come out of, and the patient will not feel any difficulty of breathing. This is the case of non-asthma. So non-asthma in normal circumstances when the patient is not they are suffering from asthma. At that time, all the muscles of the respiratory system are smooth, easy, and in a relaxing position. So that air will be passing freely, coming out and going. That is under normal circumstances. But under condition of when the asthma triggered or flared up, this is an indication the airways and air tubes are blocked or narrowed down. Air won't move freely inside and will come out. out of the body. And this symptom where the patient feel difficulty of breathing freely. When he is not breathing freely, it is a symptom and indication. It is the case of asthma. Another question: is asthma curable or not curable? Why this aspect means we do not have any curable medicine for the asthma. No, it cannot be cured. There is no sure sure medicine for asthma treatment. We cannot root out, eliminate the root cause of the disease. We cannot eradicate the cause of the asthma once it is flared up, once it is triggered. So there is no treatment. So ultimately, we come to the picture of urine therapy and the importance of it for the treatment. That's why first thing we must know means that there is no treatment in drug therapy system and other systems also. If only there may be a treatment, but there is no cure. Cure is different from treatment. Treatment means always you must go on taking medicine and depend on medicine and survive. Medicine is only a subsistence for our survival, but no cure. Permanently, we cannot eradicate the symptoms of the disease. That's why we cannot cure it. As long as the patient lives, the disease present in the body. When the patient dies, the disease also will die. So as long as the patient lives, the disease will survive. The disease will persist. That is the basic principle. So it cannot be eradicated. The symptoms cannot be eradicated from the body. There may be a treatment, but there is no cure. The root cause of the disease cannot be eliminated. This is the condition. And there is no medicine. If at all, that is only a remedy, a substitute. We have to depend on medicine every day to survive medical dependency, and it may have the adverse effect in the long term. There are some medicine, drug medicine, that is a problem. And popular medication that we are using, for this steroids, patients mostly using steroids. Bronchial dilators. There are some people use bronchial dilator. Bronchial also related to respiratory system only. Bronchitis. So that's called bronchial dilator. And the rescue inhalers. Some people use, and product is available in the market, rescue inhalers. That will come into patient rescue. That will save the patient. Otherwise, the patient sometimes will die, lack of respiration, lack of breathing problem. This respiratory will come as a rescue, save the patient from death. And another alternative is also there, that is nebulizers. People use nebulizers also. So this is a drug-based product. These drug-based product, if you use for long period of time, there may be a possibility of side effects, after effects, ill effect, and even reactions also. So medicines are there, and these instruments are also there. But possibility of side effects, after effects, ill effects, even reactions also in the long run. That is the problem. Another, why you must know this theory of asthma means we have to prevent the disease. Every person, in respect of every disease, the people must have the minimum knowledge of the nature of the disease today, and education and awareness, a guidance, self-care, self-education, self-knowledge of each and every disease is fundamental nowadays. That's why about the asthma also, every person is expected first to know what is the nature of the disease, what are the symptoms, why this causes, and what type of medicines available, what are the dangers of it, how to prevent this disease. These are the fundamental aspects that every patient, every person must know, whether affected or not affected. Otherwise, finally, you have to go for drug dependence throughout the life. And it will have its own consequences. So here now question is asthma is worst during night time? Yes, asthma is very worst, very serious during night time. Why? Because main reason, the way, the pattern in which a patient is sleeping, the pattern of sleeping, laying on the bed, bedroom conditions, so bed sheet even, and blanket, pillow cover, all this also will causes asthma. And drug dependence, drug reactions, and the dust mist, insect, bacteria. In the dust, they will be there. Dust mist, pet dogs, pet cats, insects, environmental molds. Molds means fungus in the environment. Insect, cockroaches, even the mice, and pollen from the trees. All these will contribute to the disease of the asthma. So what is the pattern in which you sleep? Bedroom condition, climatic condition, too hot, too cold, environment cleanliness, insects, fungus, virus in the environment, in the bedroom conditions, hot and cold temperature. These factors will influence is asthma. Those who have the asthma, who is already patient, when the bed condition, room conditions are not favorable, it will be very serious. Suppose fungus is there in the bedroom, say on any article in the bedroom, say on the AC machine, or you can say mirror, or curtains, or towels, bed sheet, pillow cover, and stools, chair, table in the bedroom. If there are any fungus, virus, mice, cockroaches, nighttime, the patient cannot sleep. And it will be very serious in the nighttime. Some people won't even sleep. It is very a dangerous situation. Sometimes it may involve the case of hospitalization, and it may involve to death or risk factors. So nighttime, the disease will be very serious, very worst. Because these are all the environmental factors only. Once affected, before triggering, before clearing up, no problem. Once the symptoms are there, no, these conditions should be clear. If these conditions are there, the disease will be worse and it will enhance its seriousness and they will cause much seriousness to the night time. Sleeping disturbances, sleeping disorders, sleepless nights. So nighttime, the asthma is very serious. So when once asthma is triggered, flared up or attacked, three things will happen. One is tightening. Tightening means contraction of muscles of respiratory system. This is called a tightening of system. The respiratory system will get tightened. When it is tightened now, the airways or the air tubes will be narrowed down. The air will not flow freely. Patient will face difficulty of breathing. So that is contraction, narrow down of the airways. Second is the inflammations. Inflammation means the lining of the respiratory system will swelling of the lining of the airways or the air tubes. That also will cause to narrow down the airways. When the airways are narrowed down, the patient will feel the difficulty of breathing because full air, air, required respirations, inhalation, and exhalation not possible. Patient feel difficulty of breathing. It will affect heart even. And I already said the third reason is production of excess, more than requirement, more than normal of mucus in the body. Mucus. Many asthma patients you see always they will be spitting because more mucus will produce in the bronchial system. It will come through more sneezing and spitting. These are the common symptoms of the asthma. And even WHO, World Health Organization, also recognize, and this asthma is a very serious problem in the world. And WHO has recognized this asthma diseases is a global burden disease. Global burden disease, like virus, like heart attacks, like cancer, like AIDS. And this asthma is also a global burden disease. And WHO has formulated a global action plan for this disease. Throughout the world, it is a serious problem affecting nearly more than 10 lakhs people. That's so simple figure. In USA, 25 lakhs. Even children are affected. So that's why WHO wanted and seriously considered for giving more attention for the treatment, diagnosis, and monitoring of the disease of the asthma today. Global action plan is prepared for this purpose. Even UNO also prepared a draft that is an agenda for 2030, agenda for 2030 towards sustainable development and sustainable development of asthma. Otherwise, it is a lifelong disease. Throughout the life, the patient has to suffer. Sleepless nights, uneasy life, troubled and disturbed life. In respect to other disease, that's different. You can take some treatment and it will go. But you see, it will be throughout day. Night is the worst. Sleepless nights. How many days person will live without good sleep? That's why sustainable development of the patient, because it is a global burden disease. So this is the way in which asthma is today considered. Now another aspect is how this asthma will come. What are the various causes? And this term is called in medical terminology induced. What induces the disease of asthma? Various causes or purposes that induces, that causes. They are responsible for causing or reasons for the asthma. What are they? The first is exercise induced. Exercise giving. Exercise is the reason for asthma. Games, athletics, sports. In the environment, the games means we are exposing to the environment. Too hot, too cold, and exercise that leads to the asthma. Secondly, occupational induced asthma. Occupation causing asthma. Occupation means job, work, profession, education. It means work related, workplace irritants. In workplace, whatever be the place where we are working, maybe office, maybe business, or some other place of our work, because people are doing different work, different professions, and different jobs for the sake of livelihood. And every type of work has its own environment. As occupational induced asthma means workplace irritants. In a workplace, there will be irritations. Say, suppose in the office there is no fan, you get irritated. Suppose there is a dust, there is a mist, there is a molds in the environment, fungus in the environment, no air, no comfortability. Body feels discomfort, uneasiness. That leads to the asthma. Say a person working in a cement factory, textile factory, working underground, or working at heights, working in mines, asbestos factories. This is called workplace. So workplace setting gives the disease of asthma. So it is called workplace irritants. Irritants are the substances that are found in environment that causes the disease or that causes the discomfort and inflammation to the body. Say dust, mist, gas, emissions, and biogases, temperature, heavy pressure, vibrations, smells, heat, temperatures. These are all the work-related environment. They are called workplace-induced, workplace setting factor. They are called irritants. If they are present in the environment at workplace, it causes the asthma. The common reasons are there are occupational disease or work-related irritants. They irritate the body, irritate the respiratory system and airways and tubes. So irritants are the substances only. It may be cockroach, it may be mice, it may be pet cat or pet dog, and fungus in the environment, molds in the environment, or pollen, dust, mist, gases. These are all causing asthma. That's why it's called occupational induced asthma. And another category is allergy or allergens, allergy induced asthma. Allergy induced, allergic. Allergy means, say for example, the immunity system of the patient responses, immune system of the patient responses to allergens like irritants, allergens, allergens. That allergens will trigger, will flare up the asthma. What are the allergens? Allergens also substances like irritant in the environment. Allergens also irritants in the environment where you are there. That causes the problem of asthma. The causes I already told you. Dust, mist, pollen, pet dog and pet cats, insects, fungus or the virus in the environment, or drug, a long period of drug dependence, drug reactions, cockroaches, mice. All these are all the virus causing, virus or disease causing or infection causing lives. They are irritants. They are allergens causing. Irritants causing, allergens causing. It is an allergy to the body. For allergy, there is no cure treatment. Allergy is allergy. Just to go on taking medicines, that will subside. You must depend on a tablet throughout of life. That is allergy. Anything further, there is no drug, means that is allergy. Allergy, so many causes, so many allergens in the environment. That is called allergen-induced asthma. Another is non-allergen-induced asthma. Non-allergen. Non-allergen, it is also called intrinsic asthma or atopic asthma. This asthma is caused mainly of all factors other than the factors responsible for causing allergic asthma. All other factors. This type of asthma is a common, less common, and at the same time, it is triggered, flared up, or developed at a later age of the person, later period of the life, 40s, 50s, and 60s, but not in the young age. But this type of asthma is very serious because it will not respond to standard treatment procedures. The causes for this are our lifestyles, dietary styles, occupational styles, environmental styles, social factors, cough, cold, virus, lungs infection, and recreational drugs and additive material. Recreational drugs means, cigarette, no smoke, alcohol, tea, coffee. They are called recreational drugs. Additive means a certain type of the product and chemicals are added to food products. Say, for example, preservatives, emulsifier, insecticide, pesticides. These are mixed with the product, with the tin products, bottle product, packet products. These medicine is added insecticide and pesticide for preservation of some time. When these medicine are added, drug is added to the food product, that also will cause asthma. And another type is mainly because of, or you can say, adult onset asthma. Adult onset means beginning. But at the beginning of the adult age, 18 years, around 18 years. So this type of is attacked at around 18 years of the person. Similarly, pediatric asthma. A pediatric means below or around the age of 5 years. So children also will get this disease. If children will get, this is very serious because they are small people, they do not know anything, and throughout life they suffer. Throughout life, there is no treatment. So their position is very horrible in life, we imagine. And in respect of children, we must take care of them and we must prevent the children should not be attacked by this. And another is environmental asthma. Environment. It may say, for example, water environment, noise environment, food environment, environmental pollution, adulterations, industrial waste, and say, for example, acid rain, or you can say global gas emission, ozone gas emissions, global warming, ozone destruction, forest destruction, and vehicle smokes, fumes, dust. These are all in the environment outside the home. These also will cause the asthma diseases. What are the symptoms and the dangers of the asthma? Please take very care of note of it. The thing is tightening of the airways, airflows. Air cannot go easily. Sleeping disorders, sleeping disturbances, discomforts to the body. See the symptoms and dangers of the asthma. Always coughing, always sneezing, and cannot talk freely. Pale face, sweating, and difficulty of doing work for some time. Physically, you cannot do work. Tired, tiredness, tightness, lack of concentration. They cannot concentrate on work, studies, or other works. And we have to suffer throughout life. Chest pain. They have the chest pain also. And always how they see during night time, particularly using sounds, cat sounds. Meow. This is the sound that the patient will produce whenever the patient sleep, particularly during night time. So these are all the concepts relating to the asthma. Then come to the treatment. I said already there is no treatment. The only solution is prevention. Prevention is best. Prevention is better than cure. An ounce of prevention is better than a pound of curing. Because there is no medicine and treatment. The only thing is you must have the knowledge of it and prevent from those symptoms or the causes for the asthma. That is the only solution. And be away from the environment. What are the environments we have discussed? Be away from all these environments so that you are safe. If you are exposed this environment, like environment, bedroom, hot, cold, mild, virus, fungus, and be away from these neat, clean, hygiene, and diet condition, nutrition, living conditions. And when you come to the asthma, best measure is the urine therapy. Hundreds, thousands of patients are there that are well cured with asthma. There is no any other drug medicine for this. No drug will work, but only subsistence must depend on. You must be fancy to eat with the pills always and survive on it and facing the side effects of the medicine. So it will up to the patient and to prove it, and we do not have any statistics for that or scientific evidence or any studies particular. But you come across hundreds of people relating to the bronchitis, cough, and sinusitis, this respiratory system, asthma, bronchial disorders. So these are all relating to the asthma problem. All these conditions can be cured. There is no any doubt about it. And the method of treatment is like a nose drop. And the best method is sniffing of urine. Sniffing. But to touch the brain, the sniffing is the best. Or nowadays, the popular is nose drops. This is common method. Best method is sniffing. And in addition to that, common oral drink, everyday drinking. You see a person who is drinking urine for only treatment purpose occasionally is called a follower of urine therapy. But Shivambu life is different. Shivambu life means he must drink every day. Even after drinking, and you cannot avoid affecting some disease. At that time, we can choose some other extra methods in addition to oral. So, for example, so massaging or bathing, cleaning, bandage, like that you can. Likewise, you can use drops. So anyway, urine, you adopt any method of taking it. It will work. So best method is the urine therapy. I advise the people propagate it and educate it among the people of asthma. Because the people who are suffering from asthma are hidden. They're not coming out. There are many people who are ashamed of meeting with the public. That's very difficult to identify and suggest them. But the urine therapist or urine healthcare providers, urine therapy healthcare providers, or urine physicians. You are all urine physicians who propagate it. So this is all my points of view. I want to interact with you people intern for any discussions. So I end this topic. Thank you very much.
Thank you very much. Thanks to select this. Asthma is normally in our society. I am also affected asthma last 20 years back. Since 2015, I started urine therapy that within 1 week.
Very good, very nice. You are example.
I am a testimony. Then my daughter also from asthma. Anyone can any doubt? Tiwari sir, welcome.
Shivaji.